So we have a 15-year-old girl that's developed a widespread patchy rash after receiving an antibiotic treatment for a sore throat. When you examine the patient, she has enlarged cervical lymph nodes, tender splenomegaly, and you can see the rash here. Now, what antibiotic could have been given? Could it be option A, ampicillin? Could it be B, erythromycin? Could it be C, cefuroxime, D, metronidazole, or E, tetracycline? Which one is it? So I'm going to give you 10 seconds more to have a think about. A 15-year-old girl with widespread patchy rash that you can see in the picture here. Which antibiotic could she have been given? I'm going to give you a couple more seconds now. So the correct answer, if you've chosen it, is option A, which is ampicillin. So have a think about what could be the possible causes for this particular patient with a widespread patchy rash in a patient with lymphadenopathy and splenomegaly after a course of antibiotics. Now, the clinical scenario as being described is the fact that this is highly suggestive of a patient with something like a viral xanthem, of an infectious mononucleosis possibly, which then may have being given antibiotics, which then has resulted in an antibiotic-induced rash. And infectious mononucleosis is caused by Epstein-Barr virus, EBV, which is obviously characterized by fevers, pharyngitis, which is inflammation of the pharynx, lymphadenopathy, and splenomegaly. So that's why we see here in the vignette that this patient has got a tender splenomegaly, this enlarged lymph nodes as well, and also a previous history of sore throat. So this would all fit in. And when patients have undiagnosed mononucleosis, which is obviously a viral infection, but has been given antibiotics, obviously incorrectly, especially penicillin-based ones, especially that of ampicillin or amoxicillin, then they develop a distinctive maculopapular rash. If someone gave something like benzyl penicillin, a much more specific type of penicillin, the actual antibiotic rash is much more reduced. So ampicillin and amoxicillin are the main culprit. Now, this ampicillin or amoxicillin-induced rash in a patient with infectious mononucleosis is a very well recognized phenomenon. It occurs in a vast majority of cases, more than 80% or so. The exact mechanism isn't entirely fully understood, but is really thought to be related to some sort of hypersensitivity response relating to the interaction between the antibiotic and the Epstein-Barr virus. And typically, the rash appears 7 to 10 days after starting the antibiotic, and it resolves within a few days to a week after discontinuing the medication itself. So obviously, if you recognize the rash and recognize the timeline and recognize the original IM infection, then obviously you will get the answer correct. Now, what else could the answer be for someone like this particular individual? Now, could it be just a simple acute viral xanthem? So by that, I mean, it could be something like a viral rash due to a virus itself, like a measles, rubella, parvovirus 19, that can all cause widespread rashes accompanied by fever and lymphadenopathy, but they don't tend to cause splenomegaly. And also, furthermore, the question specifically asks what antibiotic could have triggered this, and the ampicillin / amoxicillin induced rash here post infection mononucleosis is the more common type, rather than this caused by a virus rash by itself. Could it be something like acute HIV infection? Certainly during the acute phase, you may get a mononucleosis like illness, fevers, pharyngitis, lymphadenopathy, and a maculopapular rash, but there's nothing in the vignette to suggest that this is a patient, a child with HIV risk factors. Could it be Kawasaki disease? Now, this Kawasaki is a vasculitis which primarily affects children and causes a rash, cervical lymphadenopathy, splenomegaly, and fevers as well. However, what this particular case said is the fact that this patient only developed this rash after being given antibiotics, in which case ampicillin is going to be more likely the correct answer than anything else. So Ampicillin is the correct answer. Beta-lactam antibiotic is the most likely culprit in a rash for a patient with had presumed infectious mononucleosis, and this widespread maculopapular rash develops in nearly pretty much all cases of IM. For those at least that are treated with ampicillin or amoxicillin, and this is going to be a hypersensitivity reaction.